The most common medical emergencies on campus would vary from anything involving anxiety or anything stress-related, panic-induced. We also have a lot of drug-related, narcotics, alcohol-related, things of that nature. Overdoses, underdoses, a lot of those are related to diabetic emergencies. And then we also have a lot of traumatic emergencies, bicycle accidents, skateboarding when people shouldn't be on campus, or car accidents, or some combination of all those things. So let's say you're at the gym and you see somebody collapse next to you. And they're either not breathing, they're unconscious, or they're showing some very unusual breathing. Worst case scenario, they're gone into cardiac arrest. It's very important that you take immediate action when they go into cardiac arrest. For every minute they go untreated, their chance of survivability goes down by 10%. First action you want to take is call 911 immediately. And if you can't assign it to someone else, then go ahead and take the extra minute or so to find a phone yourself, call 911, and then make sure you get paramedics en route. And then once that happens, if you have a responder available to do so, go ahead and have someone grab the AED or the automated external defibrillator. You're going to see on campus are all the same model. They're very straightforward. There's a single button on top, and you're going to open it there. And now once you have this open from the front, it's going to turn on automatically, and it's going to start speaking to me very shortly. And you're going to pull out the pads and do everything that it says.
Open package and remove pad.
And you go ahead and listen to it. It's going to tell you to put the pads on. The pads are very straightforward to use. It has a diagram on there, and it's always going to tell you to put one pad on the upper right of the chest and the second pad the lower left. If you cannot get them backwards, they'll work as long as you have the pads, one pad in each of the appropriate locations. And then continue appropriate CPR, and then just go ahead and do whatever the defibrillator tells you to do, whether it's going to be stand back and let it deliver shock to the patient, or continue to give continuous compressions. Technique is probably the most important thing, because you can give CPR, you can give somebody CPR for 30 minutes, but if you're not doing proper technique, you're not giving that person any help at all. And so what I mean by good technique is you're going to want to be able to interlock your hands, you're going to pull that hand back, you're going to expose the ridge of the palm, and that's what's going to go over the person's sternum. And then once you're over the person's sternum, you're going to lock out your wrists, elbows, shoulders, and you have your shoulders directly over your wrist, and that's going to allow you to use your body weight to do all the work. And so when you actually give a person a chest compression, you're going to bend at the hips, and up, and down, and up, down, and up. And you're going to do that for a full 2 inches every single time. 2 inches will compress the heart and allow the blood to circulate. And you're going to go at a rate of 100 compressions per minute. And you're going to continue to do that until the paramedics arrive, and you're going to give the person the best chance of survival.